we insisted on the fact that there's not any sign of influenza right now, but it will be the case in a few weeks from now, which is always the case. And in regards of the respiratory syncytial virus, it's already inside the Quebec province.
Quebec's public health provided an update on the circulation of respiratory viruses and on its fall vaccination campaign. The most vulnerable, those 70 and up and the youngest of the population, as well as those with chronic illnesses and the immunocompromised, should get vaccinated. The National Director of Public Health, Dr. Luc Boileau, said at a press conference on Monday that with influenza and RSV slowly rising, the presence of COVID-19 remains high. People at risk of complications like those immunocompromised and most vulnerable are asked to book their appointments through Click Santé or call 1-877-644-4545. Administration will begin at local points of service like pharmacies and more on October 16th. On that same day, the general population will also be able to book an appointment.
The vaccines are new. We expect them to have great efficacy, and we suggest people to get benefit from it because we're opening the accessibility of it mostly for people that are at risk.
Dr. Boileau said that they want to vaccinate at least 80% of those in the province's CHSLDs and are hoping that at least 70% of people 70 and over also get vaccinated. That's the public health target. Epidemiologist and cardiologist Dr. Christopher Labos reminds people of basic respiratory hygiene like hand washing, wearing a mask, and suggests an alternative way to manage your respiratory system.
The other thing that we can do as a society is we need to start cleaning our indoor air. So we live in buildings and work in buildings primarily where the windows don't open, right? So we have created building space that for the reasons of energy efficiency uses recirculated air. Well, we need to start cleaning that air, otherwise we are going to keep getting sick.
Labos said with the start of the school year, it's common for many to get sick. Last month, the RSV vaccine was offered for free to certain priority groups with the hopes of immunization against the infection. Dr. Caroline Quashtan said at the press conference that newborns under 6 months old and those at risk up to 18 months old will be able to get an RSV immunization agent starting early next month.
What we see in data and modeling, mathematical modeling, is that those that would most benefit from it are those age 75 and over with a medical condition. It is approved for 60 years of age and over. It is available for purchase in pharmacies, but at this point, the group that really seems to be at higher risk for RSV and its complication are the older ones.
In Montreal, Tehosterihens Deer, City News.